and you can click your language there. I think we have almost everybody joining us at this moment, so we'll go ahead and get started. While we're doing some of the logistics of the webinar, please do feel free to type into the main chat box where you are from, your name, and your organization. And I do apologize, my cat is making a lot of noise at this very moment, so apologies for the background noise. I'm Danielle Heiberg. I'm the Advocacy Advisor with Global Water 2020, and I'm excited to have you join us for today's discussion. We'll start the session with just a few short remarks, but the majority of the time today will be an open discussion so that you can share your experiences, successes, and challenges and learn from each other. Before I turn over the discussion to the facilitator, a few logistics. As I've already mentioned, the webinar is available in French, English, and Spanish. By now, you should have already selected your language using the interpretation button at the bottom of the screen. To help the facilitators, when speaking, please be sure not to speak too quickly. And from time to time, comments may be repeated in English to facilitate the translation. The webinar is being recorded and will be available in all three languages on Global Water 2020's YouTube channel later this week. Please use the chat box for comments, reactions, and questions. If you would like to speak during the open discussion portion of the session, you will need to use the raise your hand function and wait to be called on. And we'll go over those instructions again when we get to that part of today's discussion. And now I would like to introduce the facilitator for today's discussion. Ellen Walter is an international advocacy expert at IRC, where she leads the international component of the Watershed Empowering Citizens Strategic Partnership. She has worked with the US government as well as the private and nonprofit sectors, including as a sustainability director with WASH Advocates. Over to you, Ellen.
Hi, everyone. Thank you so much for joining us today. We're excited to have you here as part of this great roundtable discussion. We're excited to see so many people representing so many places around the world and such diversity of experience. Some of you I know and know the great contributions you've done in advocacy, and so we're excited to hear from all of you today. We're going to start off today with a brief remarks from Angela Nguku. Angela is the founder and executive director of the White Ribbon Alliance Kenya. It's a people-led movement for reproductive, maternal, and newborn health and rights. She is passionate about maternal, newborn, and adolescent health. She is the champion whose career spans over 16 years of dedicated work towards ending preventable maternal and newborn deaths globally and amplifying the voices of the marginalized and vulnerable populations in Kenya, throughout Africa, and around the world. So what I'd like to do is turn over at this point to Angela. Please continue to use the chat box for questions and comments and other feedback throughout Angela's presentation here. So Angela, over to you.
Thank you so much, Ellen. Thank you for the humble introduction. I was turning on my video for a short time and I turn off because I know my network might have instability because my power is not stable today. I just wanted to have everyone see my face so that they can put a face to the name, a name to the face, or a face to the name that I'm going. So in case I go off, just want everyone to know that this is me. Let me say that I'm a graduate midwife. So today I'm not generally speaking as an advocate, but also as a graduate midwife. I've worked within different countries across Africa, across Asia, and partly in Bolivia, remotely, but also in person. And what I witnessed across these countries. Can you hear me?
Yes, Angela,
Yes,
we
we
can
can.
hear you wonderfully. Please go ahead.
Oh, I
For
thought.
those who cannot
Yes,
hear,
yes.
select
Yes,
mute
we hear you.
original audio and you'll be able to hear Angela.
Okay, sorry about that. I was saying that from what I witnessed across the countries that I worked in, I decided to stand up and speak with and for mothers, newborns, adolescents, and citizens in general, because I realized that quality, equity, and the dignity in our healthcare facilities must and should be restored. I'm saying this because I became an advocate because of what I saw mothers going through in health facilities, and as a midwife, as a development worker, and basically as a citizen with rights, I felt like something was amiss, and I thought I needed to speak up. Just to start by can you hear me now?
Yes,
Angela, I hear
Yes.
you fine here in the United States.
Angela, we can hear you, and you cut out for just a moment, but please continue forward. I think it's a matter of interpretation. And so anyone who, please make sure you're choosing the correct language, and then you want to click the button that says mute original audio so that you can hear the translation correctly. Thank you, everyone. Angela, please go ahead.
Thank you. And let me start by saying, defining what I decided to do, and that is advocacy. Advocacy is a set of activities by an individual or group of persons aimed at influencing decisions, either at the political, the economic, or social space. And that is what I decided to do. I decided to leave the bedside. I decided to leave even the programming world where I'd been for around 14 years, and founded and started leading the White Ribbon Alliance in Kenya, because I thought that was what was necessary, and I needed to do something to actually join and bring the voices of women and girls who are suffering in our health facilities to the fore. For those of us who are less familiar, White Ribbon Alliance is a global network whose mission is to propel a people-led movement for reproductive, maternal, newborn, and health rights. While many things have changed since we were formed a few years ago, one thing has remained true today as it did then, that meaningful change can only be sustained through the will of the people. And that is why I decided I needed to be part of that change. And that change can only be realized if all of us join hands as health workers, as citizens with rights, as development workers, as donors, as private sector practitioners, or just individuals, because I at that moment realized that healthcare is everyone's business. And so much so that quality healthcare should be realized by all of us, irrespective of your race, your class, your creed, wherever you are from. Quality healthcare is really a realization. Let me take you through a campaign that we did as White Ribbon Alliance that I will be speaking to. And I would want to hear at the end of the day, what would be your commitment towards realizing the right for reproductive, maternal, newborn health care in our health facilities? So in 2018, as an alliance, we decided to launch what we call the What Women Want campaign that was launched on the International Day of Maternal Health and Rights. That's on 11th of April every year. And we went out to ask women and girls, what does quality reproductive health services mean to you? We decided not to ask the health workers, the programmers, the policymakers. We decided to ask women and girls, the clients themselves. And we asked one simple question: what does quality reproductive healthcare mean to you? Our open-ended question let women and girls set the agenda, as opposed to beginning with a premise of what is important, or asking them to decide among a set of options, like we always do. Women's answers were often unexpected, challenging assumptions and shining new light on the realities of their daily lives. We got 1.2 million responses. We collected.
Angela, sorry, I need to interrupt you for just one moment. My apologies. When you choose the language at the bottom, I need you to not choose a language. You've chosen English, which means only anyone else who's chosen English can hear you. So I need you to go back to where you chose the language and turn it off so that the interpreters can also hear you.
Oh, I'm so sorry.
No, that's okay. We didn't tell you that. So yes, please make sure you do that. And then continue. I apologize for having to interrupt.
So what?
All right. If you want to try speaking now.
Can you hear me?
Yes. Can everyone hear her now?
Yes, please.
Loud and clear.
The Spanish
Okay.
interpreters cannot
I
hear
continue?
Angela.
The Spanish interpreters cannot hear Angela.
No, we
Okay.
cannot. Sorry.
Okay.
Okay. I do not know what I'm supposed
Angela,
to click because I've clicked.
Angela, just continue on. We'll see if we can get it fixed from the back end. Please go ahead.
Thank you. I was saying that, sorry about that. We collected 1.2 million responses across 114 countries. But most of this came from 8 countries, mostly in sub-Saharan Africa. And underpinning the analysis was a commitment to ensuring that every single voice was counted, every voice was heard, and the voices of these women and girls were very clear. The number 1 response in Kenya was water, sanitation, and hygiene, that is WASH. This was number 2 globally, meaning that it's an issue that does not just happen in Kenya, but across board. Women believe that strongly that part of having quality and dignified experience during childbirth includes having health facilities with running water, clean toilets, clean beds, and linen. Women are tired of being told to come with buckets to store water for bathing. Women are tired of buying water from vendors while in hospitals. Women are tired of being told to wash their beddings and clean their delivery beds. Women are fed up of being told to brush their teeth in clogged, smelly sinks in health facilities. Women are tired of wading in floors littered with blood and low-care because there's no clean water to clean their facilities. The second demand that we had that is tying to the first demand was respectful and dignified care in Kenya, which was number 1 demand globally. Women want to be listened to. Women want to have an interpersonal connection with their health providers. They want compassion as any other health outcome. Should I stop and get everything fixed because I see people can't hear me?
Angela, why don't you just continue on? What I'll do at the end is try to provide a little bit of an overview of the highlights, and then people can go back and listen to the recording and we'll, after the fact. So please continue.
Okay. I was saying that the second demand was respectful and dignified care in Kenya, which was number 1 demand globally. Women want to be listened to have an interpersonal connection with their health providers. They want compassion. And part of that dignified care is delivering in a clean health facility with running water, a place they can feel respected to deliver in, a place they can comfortably take a bath, have a meal, and get out with no hospital-acquired infections. There were many other responses that we had, and I could list, but I decided to list those 2 key because they are very tight. They were the top most requests in Kenya, but globally. Women want and are demanding basic infrastructure, basic water and hygiene, basic decency. Their responses demonstrate that despite best efforts, we are not meeting women where they are. We should continue to aim high, but if we cannot provide the most rudimentary needs, we will never prevent women from dying during pregnancy and childbirth, or create an environment where girls grow up empowered to understand and direct their own reproductive health care. As progress on maternal and reproductive health stalls and even reverses in some countries, we need to do something different, something radical. We need to listen to women and girls because we know they are the critical users of our health facilities. We know that it should not be radical, but then it is, and it has to be. If we want women and girls to visit health centers, if you want them to adhere to the recommended advice that we give them, if you want better maternal health outcomes, their agenda needs to become our agenda, which brings me to our commitment as White Ribbon Alliance. We have decided to engage our vast membership, partners and allies, policymakers, health workers, journalists, donors, implementers, and of course, advocates to place water, sanitation, and hygiene high on reproductive and maternal health agendas within Kenya and within our focus countries. This is in addition to the other key demands. We believe that we already know what working in silos is unhelpful at the end of the day. And yet, the more expert we become, the more likely we are to pursue our expertise in more elaborate detail. That women's highest priority demands often intersect with one another. And this reminds us that women's healthcare is one big interconnected challenge. If we attempt to address these demands from our usual silos, we risk missing the full picture, with lives and well-being of women and girls being the consequence. It's obvious that women and girls want to and need us to work together. In answering the question, what is your number one request for maternal and reproductive healthcare? Women did not silo their responses. So why should we, as implementers, as health providers, as donors, as journalists, as whoever is caring about women and girls? And to make sure we don't silo, we will continue to mobilize the voices of women and girls to collectively hold on to not only their leaders, but our community, ourselves, accountable for meeting demands as they articulated them. These are our next steps, but what are yours? You is listening to me today. I'm asking you that you join us in our call that cuts across, that transcends all health and development topics, a call to listen to women and girls. Let's make it a standard operating procedure to have women and girls actively and meaningfully involved in designing policies and programs, which are meant for them, not just as a talking point or was a radical notion. All this calls for a sea of change in ourselves. There has been plenty of local, national, and even regional and global rhetoric about prioritizing the needs of women and girls. But they are telling us that we are, in fact, not listening. For the undeniable fact remains that even that, after decades of effort by the global, regional, and national community, we still have not yet done what women want. Paying closer attention to what women and girls are saying is more important than ever. And we know that pre-COVID, women were already telling us what they struggled to reach health facilities. Women are now facing much more challenges than it is before. And we know that COVID has done us no favors, but it has starkly highlighted how much we still need to do to make sure that women and girls get water. Wherever they live, get their right to safe, decent, maternal and reproductive healthcare. If we are going to build back better, what women want cannot be the purview of a one campaign. Rather, respectively asking what they want, listening to and acting on what they tell us has to be our today business. Each and every day we must think about what are women telling us quality reproductive healthcare means to them. Not just during emergencies like during COVID today. Women are telling us to raise our heads from our studies, proposals and policies to extend our gaze beyond our chosen topics and budgets, suspend our quest for the fastest and latest technology fixes, challenge our own assumptions and assuredness, and listen to them. Equipped with these tools, we can collectively take one step closer to heeding their call. We have no excuse other than our own indifference. So what do I hope you to conclude from the What Women Want campaign? Firstly, you might think that you know what women and girls want, but we do not. Not unless we systematically ask and respectively listen to women and girls. Secondly, what women want is rich in local details, but also very simple and entirely achievable. It is we who overcomplicate things. Thirdly, women have told us what to do. Now they want us to do it. Women want us to hear them, to value them and what they are saying. Practically, meaningfully, and urgently. The challenge is to you. What are you going to do today? Thank you.
Thank you so much, Angela. Again, we apologize for all of the technical difficulties. We're trying to get this resolved. For now, I just wanted to give, I will not probably do it quite justice, but I wanted to give some of the highlights of what Angela was talking about and provide an opportunity for any questions that anyone has. And please put your questions in the chat box, or you can raise your hand. and we'll see if we can get some clarification or elaboration on what Angela has said. So a couple of highlights. The White Ribbon Alliance did a What Women Want campaign to find out what it is that women really needed and wanted. And water, a clean health facility with basic water, sanitation, and hygiene was high on that list. They wanted dignified care, and they wanted compassion and when they went to visit health facilities. And so it's really important. One of the highlights, I think, of what Angela was talking about is asking what they want, listening to what they have to say, and acting. That could be through advocacy and mobilizing the voices of women and girls, changing policies, budgets, and challenging our own assumptions. It's really important that their agenda becomes our agenda. And so I didn't cover absolutely everything, but hopefully I talked a little bit about the highlights. I think Angela is very passionate about what she does, and it's great to see all of the work that she's been doing in Kenya and globally. So at this point, I want to open up and see if there's any questions for Angela, for those that were able to hear her. And if not, what we'll do is we'll also be able to come back to some of the clarifying questions when we have the roundtable discussion. So if there's any questions, please type them in the chat or raise your hand. One thing that I wanted to do while we're looking to see if there is any questions is to just also give a quick definition so we're all on the same page. Angela gave a personal definition of what advocacy is. I'm going to give more of a textbook kind of definition, but I think it helps clarify, what it is that we're talking about. So advocacy is a wide range of activities that are conducted to influence decision makers at different levels with the overall claim of combating the structural causes of poverty, injustice, women's and maternal health, other social issues. And so it's this opportunity that we have to amplify what we're doing in all of our work through using our voice, influencing policy and amplifying the work that we're doing for greater change. So I'm going to go over now to any questions. There was a question, Angela, for you about has the Global Alliance registered any tangible response from the respective stakeholders as feedback to the issues raised in the countries involved? So has there been any particular action or response based on particularly in Kenya or in any other countries where the White Ribbon Alliance is responding to the What Women Want campaign? Angela, if you wanted to take that question, that would be great.
Yes, thank you. You can hear me?
Yes, I can hear you. I don't know if everyone else can hear you, but we'll just go ahead. It's being recorded, so please
Okay.
respond.
Yes, we have had a lot of responses from because we've used the responses that we got, the way they were collated, we took them to different policymakers across the different countries that we worked in. So from Pakistan to India to Malawi to Nigeria to Kenya to Zimbabwe, to different places, we've had change in different perspectives, in different aspects. Some of them have been integrated within the UHC aspects. One key thing that I have noted in some of the counties that we work in Kenya and some other of the countries is the voice of citizens are actually being recognized as a key decision in shaping the policies that they are doing. But more to that, there have been policies around water in health facilities in some of the counties that we work in some of the countries in Nigeria, in Niger State, in Malawi, in Pakistan, in different countries, including even in Tanzania. So I can say that that has become our foundation of the work that we do, and we are hearing and using that as our advocacy evidence to actually push for policy changes and programs across board. Some of them at small scale at health facilities, some at big scale at policy level, yes.
Great.
And we are not relenting. We are still carrying it on.
Thank you
Thank
so
you.
much. Angela gave a couple of examples and that there have been key decisions at country level. There has been in a number of other countries, changes in policies and other actions that have taken place based on the campaign. What I'm going to do now, because I think people are still having difficulty hearing Angela, Angela, I'll ask you to look through the chat and see if there are some responses that you could provide in the chat to everyone. There's a lot of really great questions about advocates and how to address obstacles that they're coming across, like around prioritization. So I would ask Angela if you could just take a look. And for those questions that we can't get to now, we'll make sure that we share those with Angela and that we provide some follow-up after the fact. So I want to switch gears slightly, and we're going to attempt a poll. We'd like to know from all of you, there's a large number of people on the call. We want to know what your level of experience with advocacy is. So what experience do you have with advocacy for WASH, or specifically for WASH in healthcare facilities, or even from, WASH in health? Sorry, or just from the health perspective or some other sector perspectives. So please, when you get a chance, take the poll and click submit, and then we'll give you a moment to respond, and then we'll see some responses. Hopefully everyone can see the poll. And we'll just wait another minute or so, but we're excited to have you all here and looking forward to continuing the roundtable discussion and hearing a lot from all of you about your experiences with WASH and healthcare facility advocacy and the work that you're doing. Great. So if we want to end the poll now, I know maybe not everyone got a chance to respond, but it looks like we have a lot of people who are coming in with some experience or a lot of experience. It's great to see the diversity, though, for those with maybe no experience or little experience, to see how this could apply to the work that you're currently doing. So it's great. Thank you so much for responding to the poll. We're going to switch over now to the rest of our session, talking specifically about the local advocacy that we're all doing. So campaigns, efforts that you have that have made them successful, or what has failed and how you've dealt with that failure related to advocacy. So what I'd like to do, this is a roundtable discussion. And so this is, we want to hear from a variety of people. This can be within the chat. You can raise your hand and we'll call on you to give a verbal example. And just to, I want to tell you that we will be, so that the French and the Spanish interpreters can't hear each other, that we will, I'll be repeating anything that was said in French into English, so that it can be reinterpreted back into the other language. So please bear with us as we're trying to share those things. So if anyone has any examples of local advocacy campaigns, successes that they've seen in the work that they're doing, and it could be related to WASH and healthcare facilities, specifically, it could be at a local community, district, regional, or national level. It could be at a global level. So we're excited to hear from all of you. So I'm just going to open up here. We're going to start with, hold on one second. We're going to start, we have a number of people here who we'd like to call on first. So I want to start off by asking Satya Naran Ghosh to start us off. He is with Terre d'Homme, so maybe you can start us off. Satya.
Thank you, Ellen. Yes, I'm Satya Narayan Ghosh. I'm Satya Ghosh. I'm known as Satya Ghosh, and I work for TDA's Foundation in India office as National Coordinator. And I bring around 16 years of experience from the WAS sector, and in my all throughout the professional career, so advocacy was one of the key components. So now in Indian context, when I talk about the advocacy, is not only for WAS, but for all other advocacy. So there are, in my experience, there are 4-5 points, and this is actually a 4-5 points agenda to be successful in advocacy work. The one is, are you alone advocating, or you have a group of people, or a group of people from the system which you are advocating? So say, for example, what I'm saying, that if I want WAS in healthcare facilities everywhere in a district, so 100% healthcare facility coverage with improved WAS services and facilities. And if you are piloting this WAS project in one small geography within that district in terms of modeling the approach, and then advocate that approach with the district government to scale that up for rest of the places in the district, then the questions we should ask ourselves that, are we alone speaking about that model, or we have somebody from the government systems who also speaks about that model? So that's a, I think important point we should take, and my experience says that the advocacy were highly successful when part of the government system, mainly the grassroots government bodies, if you can bring them in the front line in your advocacy effort, and if you move your advocacy agenda by the local government bodies to the upper level of the government system, then that works very well, because government has to listen. The district government or the state government, the upper level government has to listen to the grassroots level government authority. So therefore, my experience and propositions would be, when we model the approach for advocacy, when we create an advocacy effort, we must take the local government authority on board, capacitate them, enable them to speak in the same line of advocating the approach that we want to be scaled up everywhere in the district at the national and state level. Similarly, so this is agenda number one. The second agenda point is that, so what is the model? So when we are designing a model approach, which we would like to be, which we like to advocate for, now there are few questions we should ask about that model. Standing in the SDG era, we must ask that whether this model looking for a equitable, universal, and sustainable coverage or not. Say, for example, in a district, you have 10 blocks, or 10, that district divided into 10 different geography, and 10 government authority you have, a small government authority. So now, are you developing your model by selecting a few healthcare facility, not 100% of the healthcare facility of that particular geography where you are modeling the approach, or you are modeling the approach in a way that you are developing a geography where every healthcare facility are covered with improved services, and not only healthcare facility, everywhere in that block, every village, every healthcare facility, every school, every institutions. So now, And that is what the model we need, the national government and the world leaders need to drive the SDG Agenda 6. And that's what I think, while designing the model, we must think that what model we are talking about, what model we are designing. Are we designing or promoting or developing a model which answered the question of universal coverage? Everybody. Otherwise, we end up repeating the same thing what has happened before, like we improve the coverage level, but we miss the most marginalized and the last mile population. So that will not work. And if we advocate for the model which doesn't have the answer to fill the gap of SDG, perhaps that will not work. And people will not be interested to hear that. So therefore, the second question was that. Now, third question is, are we doing that professionally and regularly? Now, this is the biggest problem in India, and I think everywhere in the world as well, that people who play advocacy role, often they do voluntarily. And they do that maybe regularly for the period of project period. But after the project periods, they do that when once a year or twice a year. So that's very irregularly. Now you know that getting the state government or national government agreed and adopt the model to scale up everywhere in an essence or state, it's not a one-year job. It would be actually a kind of little more than 1 year job. So that might go beyond your project period. So therefore, what we have to put in place and ensure that the advocacy efforts is being carried out continuous basis, not limited within the project period. So therefore, now professionalizing the advocacy effort is very important. You have to keep talking, and then you don't, we should not leave the ball rolling until we get to the point. So we have to keep rolling the ball. That's what my point. So this is the third question we must ask. And now the fourth question is, the advocacy, how we are doing that. So do we have a clear piece of evidences? And who developed that evidence? Who validate that piece of evidence? That's very important. So often I have seen, and I was part of those evidence building as well, that evidences were built up, but mostly that was built up by the implementing organization. So who is developing the model? So it's very important that we get a validation from somebody outside, like the government authority within the system, somebody also validate and put a stand that yes, what you are saying, what your evidence is saying is accurate and is very right. And so
Great.
that gate actually weight. So those are the 5 points agenda, I believe, to be successful in any advocacy work. Thank you.
Thank you so much. That's great. I think you make some great points. Creating champions within local government, having a model that actually works, professionalizing advocacy so that people aren't just volunteering, using that consistent voice, knowing that advocacy takes time, and using evidence. Those are really great points. I want to hear, we have a lot of comments and feedback that's coming in the chat. So I want to turn over now. There is an example of accountability and strategies that could be undertaken from the Association Crades Ambanda. Sorry, I'm not sure exactly, I didn't pronounce that correctly. It's someone who is representing a French organization. So if you can unmute yourself, we'd like to hear from you. Please go ahead. Let's see if we can't have that, hear from them and see that example. Great. It looks like we might not be able to, we'll come back to that person. Right now, there is also an example from WaterAid, I think in Pakistan, that's Sehar Timur, about understanding the existing policies as a key component. Sehar, if you can unmute yourself, we'd love to hear from you.
Hi, can you hear me?
We can. You're a little bit soft. I don't know if you can get a little bit closer to the microphone.
Okay, now is it better?
It's a little bit better. It's still quite soft, but please go ahead.
Okay, thank you. So here in Pakistan, we have a project with Global Affair Canada, which we are implementing in a rural area where we will be, building some healthcare facilities. But of course, when it comes to advocacy, it is important that we lobby with the government and understand what are the current gaps in the policies. And what we are currently doing is that we are looking at the existing gaps in the policy in terms of health policies, and we are also working with education department and health department both in schools and in healthcare facilities. So we are looking at the existing gaps, and we are pretty much sure that there are a lot of things that we can do to make it more accessible to women. And then we will continue to work with government and policymakers. We'll be training their staff, healthcare facility staff, and then telling them to advocate for themselves and also with the policymakers on how to change policies and making them more accessible to women to ensure their dignity. So this is what we are doing.
Great. Thank you. I think that's a really great point that you have here about identifying gaps in policies, not just in one sector, but across sectors, and to see how those gaps in policies where you have, a cross-sectoral issue such as WASH and healthcare facilities, where do those gaps exist in the policies, both from the health side, from the WASH side, but also, how does that affect, for example, education policies? I think, about health and WASH in schools. So making efforts towards addressing those gaps, I think, is great. We want to go now to, sorry, I'm just pulling up. We have a couple of other questions and things that we'd like to hear, but we wanted to hear if there's a difference between the way that advocacy is being done or from WASH professionals versus health advocates. We have diversity among our audience here, addressing both those that come from the health sector and those that come from the WASH sector. Are there any differences in the way that you advocate or what it is that you do to advocate for WASH in healthcare facilities? So if anyone has any comments related to that, I know that we have, I hope that Annie Sharia Masosa with WaterAid is here. I don't know if she wanted to provide any response to that question or to provide some examples of the work that that she's been doing. Annie, are you there?
Hello, yes, I'm here. Can you hear me?
Yes, we can. Great. Please go ahead.
All right, thank you. I think to respond to the question that has been asked in terms of the differences between health and WASH advocates, I think in looking at the experience of Malawi, what we find is WASH advocates tend to use more insider tactics in as far as doing the advocacy is concerned, where they want to have a seat at the table and then work with the technical, the technical arms of government in terms of whether it's reviewing policies or proposing solutions towards, the issues around WASH in healthcare facilities. This is in contrast with health advocates who are also have got quite strong civil society and are willing to come out and speak out more publicly about the issues that are there within the sector. So having said that, I also want to give a little bit of an experience in as far as advocating for WASH in healthcare facilities is concerned, and some of the experience that we have had being a WASH organization, but also having close links with the health sector. So I will speak to this in as far as COVID-19. I was concerned because as WaterAid, we started our work on WASH in healthcare facilities as far back as 2016. And over the course of it, we actually designed a program which we're calling the WASH 150 Healthcare Facilities Challenge, trying to get stakeholders to take more action on improving WASH in healthcare facilities. So when COVID-19 came, we were still at a point where the issue of WASH in healthcare facilities is not very visible, both to this, to the policymakers, but also to the population. And in our context, what we find is politicians tend to respond to scandal or things that they see as costing them votes. So when COVID-19 came, there was a lot of skepticism about its existence. And it came at a time when we were having a political campaign that was going on, and we were having presidential elections being rerun. So we saw, one key thing that we saw is there was need to bring visibility to the issue to the people. And we did this through radio phone-in programs because we couldn't really do a lot of physical contact with the population. Radio phone-in programs where we wanted the communities to talk about their experiences and bring out the challenges that they are facing in order to start to get attention to the issue. Other things that we did was direct engagement to the new president, writing the new president about the issue, engaging with the Minister of Health, the Minister of Education, the Finance Minister, using all those different platforms for us to bring the issue to the policymakers. And something that we also did, that we do not normally do, is we took opportunity of whatever other stakeholders were doing that was speaking to our issue and was going to bring visibility to our issue. So if there was something that was there in the papers, whether on the WhatsApp, on the internet, that was highlighting the issue, then we were taking the role of also bringing greater prominence to it by sharing it more, irrespective of which organization it was actually coming from. And then what we also did was to also rely on the alliances and the collaborations and make sure that we are bringing that issue in whatever opportunity that we have, so that the policymakers are hearing this issue from so many different stakeholders that they also have to pay attention to it. We also supported stories of survivors of COVID-19 and speaking about their experiences regarding WASH, including the use of our WASH champions. And at the moment, we're actually planning to use the Deputy Speaker of Parliament, who recovered from COVID, to also highlight the issues regarding the need to improve the situation of WASH in healthcare facilities. And another platform we engaged with was the WASH cluster, because the original resource allocations for COVID-19, it was less than 5% was allocated towards WASH. Yet WASH was one of the key, first point of defense for COVID-19. So we also did a lot of engagement there, talking about the issue in the WASH cluster. And we have started to see things turn around in that even in the WASH cluster now, with the current allocation for COVID, they are allocating about 20% towards improving WASH in healthcare facilities, which is something that we have not seen in the WASH sector before, as a result of the advocacy that we have been doing. However, we still saw there was an area that we could have done something more about, but that we didn't, because our focus was very much about getting the resource allocation, which was also supporting efforts around accountability. Because what we're seeing now is, based on the reports that are coming out, a lot of the COVID funds were actually spent on allowances and not provision of services that are needed within those settings. So this is also something that for us we noted as a blind spot in as far as raising the issue is concerned, but ensuring that you do not just get the allocation, but that the allocation actually goes to do what it needs to do. So I think for us, a lesson was that beyond visibility and getting the profile, there are also certain issues that we also need to look at in terms of what it takes to actually move things from having things in the policy or the budget allocation to actually ensuring that those resources are doing whatever it is that they actually need to be able to do. Thank you.
Great, thank you, Annie. You bring up so many really interesting points here about making sure you understand kind of the system and the way that, for example, financial flow happens is really key so that you're targeting your advocacy to where it's most needed, as you mentioned around financial flows. You also talked about having champions, having someone who's experienced, a personal experience helps them become an even greater champion. That's really great. So, and you also bring up about adapting your advocacy and your advocacy approaches in the time of COVID. I think that that's really an interesting thing. And so there's a couple of people that we want to hear from, but I'd also like to pose some more questions for folks to be responding in the chat. How have you adapted your advocacy, whether that was COVID related or having to adapt your advocacy because it wasn't working around WASH and healthcare facilities? There were some great comments about the overlap between and siloed approaches in a sector versus combined approaches. So I'll just add that to our list of questions for our discussion. But I want to turn to Benita Pudel from the Swiss Red Cross. If you have any comments, you have some really good points in the chat. So I don't know if you wanted to share those with everyone.
Thank you, Ellen. It's a great opportunity to be here and hear from Angela and Satyanarayan and you on this discussion. Yes, in this WASH and in other community approach in healthcare center and in the community, as in the Red Cross, we have always worked as a community engagement and accountability approach, where we would always work with the community or the stakeholders that we have in the center, that we try to build their capacity to advocate for themselves and to identify their problems, to identify their solutions that is applicable to the local context. Also from my experience, from my recent mission in South Sudan, that we also worked with the community to have a group by themselves, including the most vulnerable people, that includes the women, young girls, people with disability, that they could speak for themselves and they could identify the problems that are there for them. So those groups that could identify and advocate for the WASH needs in the health centers, that they had worked very well going to the different partners available in that particular location. So they had reached to the partners that was working in the WASH sectors, and they have achieved very good success in that context. Because in the WASH sector, when we say that we install the different WASH facilities, it's not enough, because we also need to have that system that also work for the repair and maintenance, and also continue for the sources, also having that monitoring for the safe access to all the people available there, including the most vulnerable. So in that perspective, I always see that we need to build the capacity of the most vulnerable or the service seekers in that particular center. And then once we have that provision, then it's very easy to advocate as well. Otherwise, it becomes every time that influenced by the implementing partner or the donor, then it doesn't become sustainable. Until we are there, it is there. After that, then it doesn't be that level of advocacy from their side. So also, I'm happy to hear from all of you. It's a very good, it's a very important point to be included as well.
Great, thank you so much, Benita. Yeah, that's a really great point. I think empowering individuals to use their own voice, helping them to figure out the best ways to identify what the problems are, but not only taking that first step, but also making sure that they not only have the skills, but the confidence to take action around advocacy for local healthcare facilities. So I think that's great. Thank you so much for that example. I want to turn over to Valentina Grossi. She was talking about, you know, how it's nearly impossible to silo these two issues. So Valentina, are you there and able to speak and share your comments?
Hello.
Yes, go ahead, Valentina.
Hi. Yeah, thank you for calling out. Definitely in our experience, I mean, in the Euro region, we have both high income and low income countries. So even with high income countries, I mean, even in high income countries, we have challenges with WASH that emerge even more with COVID-19 emergency. And there is even harder to talk about WASH. It's considered rather a developing topic, and we need to talk about the different dimensions of WASH separately. And another challenge across all income countries and across the entire region is really to convince countries also at the national level to integrate WASH in existing programs and across divisions. It's very hard to break the silos at the national level, and for WHO, it was not a great example even in the organization. And last year, for the first time, joint programs and publications have been developed across divisions that target WASH within the context of quality of healthcare. And I hope that probably changing also this mindset from the UN system and the different agency, we can make an example also for countries to break these silos and really work together, because there are a lot of investments and financial flows for AMR and healthcare acquired infections, and WASH is a fundamental to tackle those areas. So we had best effects when addressing those topics. Thank you.
Great, thank you so much, Valentina. We have, again, lots of great chats coming in. I saw a question, I think if it come across my screen, about if you are new to advocacy, what are some ways that you could engage in advocacy? Or how do you get started? So for those that have been doing this maybe for quite a long time, or who even come from more of a programmatic background, but have found ways to incorporate advocacy into their work, maybe we could provide some examples here. And also coming back to the adaptation of your advocacy, the question I asked before about, you know, in times of COVID or difficulty, maybe the traditional, you know, meetings with high level officials can't happen maybe in person. That's a possibility. So I think if we can just again continue to flow through our discussion, there is an example from Larry Kenmore from Rotary that he wanted to provide. So Larry, over to you.
Hi there.
Hi,
Hello
Larry.
from the United States, Siloam Springs, Arkansas Rotary Club. And yes, I speak to Rotary clubs all across the United States about stopping their healthcare facilities from what's called wasting, which we were taught as healthcare people in our early life that when we had extra medication left over, to just walk over to the sink and flush it into the water system and get rid of it. And now we have a minimum of 21 pharmaceuticals in all of our drinking water in the United States, and there's no known process to remove them from the water once they're there, except for distillation, which is very expensive to do for our drinking water. And so they are classified as forever chemicals by the EPA here. Some cities have 40 and 50 pharmaceuticals in every sip of drinking water. So in WASH, in speaking to Rotary clubs, getting them to speak to their healthcare facilities about this issue, it's interesting how there is a lot of Rotary members that are healthcare facility workers within the Rotary clubs. And it has kind of started a movement here in the United States within those healthcare facilities to stop this practice.
Great, thank you so much, Larry, for that example. So I want to, there's a great question from Jane Nabunya from IRC in Uganda. So Jane, if you wanted to ask your question, and since I know you well, I also know some of the engagement that you've had. So as part of your question to Annie, maybe you could also provide some examples of the work that you've been doing around engaging in Washington healthcare facility advocacy. Jane, over to you.
Thanks, Eileen. Hello, can you hear me?
Yes, we can hear you very well. Thank you, Jane.
Okay, thank you. I think my question was on how the engagements are done with the other partners, including other people that are equally involved or interested in the same issue. How do you bring them on board? How do you reach out to them? How do you even identify them and sort of like sort them out to know who will back you up or who may not, especially if you're dealing with elected representatives? So how is that process done? Because an advocacy campaign on an issue that is always considered a government issue, Washington healthcare facilities, it's all about health. You may have some problems on who, or challenges on who really comes on board. In the work that we do in Uganda is at two levels. At the national level, participating and engaging with the Ministry of Health, particularly the Environment Health Division or Department, and the other departments that are concerned or involved or do work around in healthcare facilities, ensuring that it's not just about drugs and outpatients and inpatients, but the general governance and management of healthcare facilities. And the kind of advocacy that we are doing or involved in is, one, to bring the issues of Washington healthcare facilities high on the agenda. It's one thing to say we have healthcare facilities out there, health centers, 2 at parish level, 3 at sub-county level, 4 at municipality and the hospitals, and having infrastructure there. But it's another thing actually having all the requirements in those healthcare facilities, and in our case, having wash in those healthcare facilities. Is water there? Where is it from? What kind of quality is that water? Is it in places that are key in that healthcare facility? If it's a healthcare facility that has a maternity and labor wards, is there access to water within the shortest possible distance, really not getting out of the labor ward? So that's the kind of advocacy that we do. And we use our work in Kabarole district to do that, and then bring the evidence to the national level and participate in the national level Washington healthcare facilities platforms that are convened by the Ministry of Health, but also convened by other partners like WaterAid that has done a lot of work around that, mainly in the city. Water for People that has done the same kind of work in Kamwenge district in southwest Uganda. So that's my submission, but also my question. And I relate that question to the way we work. For example, with civil society organizations, WaterAid, Water for People, and other organizations, we have the same vision, we have similar objectives, so we push for the same things in those localities where we operate. When it comes to partners or people like the elected representatives, sometimes you're not too sure what the politician will say, how the politician will receive the message and also forward the message, whether in council or on the floor of parliament. So there's quite a lot of work. They are generating the evidence, sharing our research findings, sometimes literally writing stuff for them if we want these things to be pushed either in the committees of parliament or in the technical subcommittees at the district level. And then with the media, yes, they are involved. They do research on their own. Sometimes they do their own interviews, but sometimes you're not too sure whether your message or the message that you really want to get out there is the message that will actually get out there. Sometimes you do work and you see screaming headlines in the newspapers, and you're not too sure where all that is coming from. So how do you relate with all those partners as you do, as you go ahead with your campaigns? Thank you, Ellen.
Great, thanks so much, Jane. I don't know, Annie, if you or anyone else has a response that you wanted to provide back to that question, you can do that in the chat, or if you want to unmute yourself and share any ideas that you have. Annie, if you're still there. Okay, so if anyone has any responses to Jane or any of the other questions that have been proposed, I wanted to go back to see if someone from the Association Crades Banja, and my apologies for not speaking French more so poorly, but wanted to share their example. And then we'll come back. We've got, I think it's Dennis from Water Aid in Sierra Leone. So we'll come to you next. But is anyone there and want to share from the Association Crades Ambanja?
Hello all.
Yes,
I'm actually talking to you from a town called Kailau in eastern Sierra Leone, a rather remote area.
Great, thank you. Please go ahead.
So, a project funded by Global Affairs Canada called HAWASH. So this project mainly targets adolescents in schools and communities in Kailau district. So we hope to expand, after this pilot nationwide, but we are using this district to test and see how we can learn lessons which we can use to replicate countrywide. So for advocacy in this part of the country, we are using a compact process, because WASH in schools and healthcare facilities, is a big problem here. And when it comes especially to menstrual hygiene and menstrual hygiene management, that's not mostly the priority of the councils and even the Directorate of Education. So we decided to use the compact tool because it has been tested before by other organizations in another district. So we decided to use a similar approach. So basically what we do, we convene a meeting of the key stakeholders, the people that matter, the drivers of policy, those that make things happen. And we interface them with the project participants. And we organize a session to identify the key issues, the problems, and how these problems could be solved. So in those sessions, through those interfaces, the problems are identified and they are prioritized. And solutions are also mapped out in a very smart way that will constitute an action plan. And that action plan is embedded in the compact, because a compact actually is like a two-way process. I do this, you do that to solve this problem, and we achieve a goal. So for each problem, there is an action point, and there are point persons, to lead on those action points with a timeline, with set targets. So there is a mechanism to review the performance of those actions. If some of the milestones and targets set are not achieved, then the compact will be set again. So this kind of cycle continues on an ongoing basis till all the targets set are achieved. So that is the process we are using as an advocacy mechanism. So the compact itself has a section for commitment. So there is an area where the stakeholders will sign to say, my ministry or my council or my division or my unit commits to this action to see that it is done by shorter time. And we and our partner do constant monitoring to remind them to undertake the action that they promised because they have already signed up to it. So that's basically what we are doing. And we've achieved some successes. You know, one is to allocate a percentage in the council budget to address MH and MHM issues. So as of now, we've had a directive from the council to see that all devolved agencies include a percentage in the annual budget to address those issues, especially in schools and public health units. So that's my submission.
Thanks. And I believe this is Dennis, is that right?
Yeah,
okay,
this is
great.
Dennis Simbo
from Water Sierra Leone. Great. Thank you so much for your contribution, Dennis. I think that's really interesting and that there are a lot of tools, and we're going to talk about that when we during the closing about the tools that you can be using for your advocacy. But I think the point that you made on accountability and having concrete actions as part of that tool and commitments that are being made by, I would say, all parties is really necessary, but being able to monitor those commitments is extremely important and plays a role in the accountability and the advocacy. So that's a really great example. Thanks, Dennis. And there are other tools that I'm seeing come through the chat that people are using. And we'll provide some other examples of tools and resources to get you going or to advance your advocacy. I wanted to turn to Faith Shabedi from the Special Olympics to talk a little bit about disability inclusive WASH and healthcare facilities, and how do you different approaches that you can take for advocating for those with disabilities. So Faith, are you there, and can you unmute yourself?
Yes, I'm here. Thanks, Ellen. I was actually responding to Lindsay's question about what is it that we want to take from this webinar. Why did we join? We realized that people with intellectual disabilities also have issues that pertains to WASH, but often when we find collection of stories or collection of issues that need to be advocated for, their voice is left behind. So it is important for us to know what WASH advocacy implementers are doing, and how can we ensure that people with intellectual disabilities are included in what they are advocating for. For example, Dennis was talking about a project that uses compact tool to advocate for health issues. And I'm wondering that amongst people that they call to identify issues, do they have a voice from people with intellectual disabilities? Because issues of menstrual health and menstrual hygiene management is a big issue amongst young girls with intellectual disabilities. The same applies to issues that would involve availability of WASH facilities in hospitals, in wards. Do people with intellectual disability get to be educated about how to use these resources? Do they get empowered to know how to advocate for issues that they need, especially the caregivers who have children with intellectual disabilities and have to be caring for them in a very difficult way as compared to the rest of the population? So my hope is that as we continue to learn of tools and methods and issues, how can we make sure that those with intellectual disabilities get to participate in this whole process?
Great, Faith. Thank you so much. That's really important. And actually, I would put that question maybe to Dennis or others who have used the Compact tool to answer in the chat. You know, how does it, or does it address people with disabilities throughout the process? And if not, how could that be incorporated into that tool, other tools, and the work that we're doing on WASH and healthcare facilities? So Faith, thank you very much for that really great input. There was a good comment in the chat from WaterAid South Africa about establishing WASH media networks via WhatsApp. And I think there is a lot of really good examples out there of different tools and approaches and other things that are being used, adapting and using the spaces in which voices are already present to try to drive some of your advocacy and to create collective voice. So I think that's really interesting. We don't have time to hear from I think Maureen it is, from WaterAid in South Africa, but I think these are all really good examples and really great conversations happening in the chat. So please continue to use that. We're conscious of the time and we want to make sure that we're ending on time with everyone. And so I have a couple of kind of highlights from the discussion that I want to cover now, just bringing us back to some takeaways. And then we'll talk about what are some next steps and where you could go for more information. So some of the takeaways that we have from today, we've heard from a lot of really great examples from all over the world, and there's even more. I know in my daily work, I work with partners all over the world, doing all kinds of advocacy at all different levels on WASH and healthcare facilities, on other cross-sectoral issues. And it's really interesting to see the diversity of approaches and the way that individuals and organizations have been able to adapt when advocacy maybe isn't working in the way that they wanted. So these are some really great discussions that we've had here. So a couple of highlights. One, creating champions within local government is really interesting. And there was a paper that we just wrote as part of the watershed program that really highlighted this element, where the more that you can involve government in the process from the very beginning in the discussions, then you create champions. So having champions that are within government, so local government advocating to national level government for the issues that they feel are important. I think professionalizing advocacy, advocacy is often done opportunistically. It's not something that gets as much attention maybe as we would like. And so the more professional and that more consistent voice that we can have with our advocacy, the better off that we'll be. Also, with a recognition that advocacy takes time, and so using strategy and planning for advocacy is extremely important. And then the other thing I wanted to talk about was that there are tools that I'm going to mention in a little bit, but the way that we can adapt our advocacy as we move forward is extremely important. So being flexible, reflecting on all of the different aspects of what's working and what's not working. But one thing I think that has come up multiple times is about knowing the system, people understanding the system, the political system, the way that policies are made, the way that budget and allocations flow is extremely important to know where to target and who to target with all of your advocacy. There is power dynamics in all of the work that we do. And so understanding those power dynamics and knowing who really holds the power to make the change that you'd really like to see happen is extremely important. And so on that note, if you could pull up the last slide that we have, I just want to go over some resources and provide some kind of closing remarks here. So we just wanted to thank you all for attending. We know that we had some difficulties with some of the interpretation today, but The session has been recorded, and we're really excited that we were able to hear from so many different people from across the globe at different levels. So thank you very much for taking the time to participate, to listen, and to share your experiences. We will be sending a follow-up email that will include information and about resources, about registering for the next roundtable that's happening, and then also making sure that you have access to the videos, to the recording today, so that you can hear anything that you may have missed along the way. And if there's any outstanding questions in the chat, we'll try to address those in that follow-up. There are two, this is the first in a series of 3 roundtable discussions around advocating for WASH and healthcare facilities. And so we want to make sure that you know about the other 2 roundtables that are coming up. The first is on March 3rd. And so you'll get information about how to register for that. That's advocating for accountability. And the final roundtable will be on Wednesday, March 17th, and it'll be about advocating for financing related to WASH and healthcare facilities. So we're excited, and we hope that you'll take the time to join those as well. And just to highlight some of the resources, that there is a toolkit on WASH and healthcare facilities, and provides an opportunity for you to explore how you could incorporate this into the work that you're doing, that was produced by Global Water 2020. There is several reports and advocacy packs that have been produced by other organizations or partnerships, things from WHO and UNICEF, tools from the White Ribbon Alliance or the Global Hand Washing Partnership. There's also an advocacy, advocating for WASH system strengthening course that also provides background on how you can incorporate this into your everyday life. There's an online course under the WASH Systems Academy that will be sharing information and resources. There are numerous papers and examples that have been produced by a large number of programs. I know that WaterAid, IRC, the Watershed Program just finished a campaign specifically on using and raising your voice. So there's a lot of resources out there. So if you haven't been engaged in advocacy, if you're one of those people who in our original poll said, I have little to no experience, we'll provide a lot of ways to get you started. And for those of you that are highly engaged in advocacy in more of an advanced way, we hope that you're able to take some examples from what you had today to enhance the work that you're already doing. So on that note, we will start to close. I just want to turn back the floor to Danielle if there's any other closing remarks that she wanted to provide.
Thank you so much, Ellen and Angela, and to all of our other speakers. We greatly appreciate all of your inputs today. And thank you to everyone for joining us today. We hope this was useful. Again, apologies for some of the technical difficulties we had in the beginning. We hope to have all ironed out for roundtable number 2 and 3, and we hope that you will join us. If you received the link directly from a colleague or from just an email that we blasted out, please do make sure that we have your contact information so we can send you the resource tool as well as information on the next 2 webinars. We will drop our email into the chat box so that you can send that to us directly. Again, thank you everyone for joining us. We greatly, on our side, I know we greatly appreciated the discussion that we had. Thank you.